Certainly want to thank everybody for taking time out of your busy lives and schedules to join us today. And we're going to be talking about breastfeeding awareness today. That's our main topic. And our panel will discuss a wide range of topics related to breastfeeding, from the current laws protecting working and breastfeeding moms to how a mother's breastfeeding experience can differ from one child to the next. We hope that everyone will walk away from today's event feeling empowered and educated, and be willing to promote awareness about the importance of breastfeeding, particularly not only in the home, but in the workplace, and that we have stations set aside so moms that return to work can continue to breastfeed and pump and provide the importance of the breastfeeding to the infant. If you look at the center of your table, you'll see a blue bag, and it's a Healthy Start bag, and you're welcome to look inside and look at what's included in the bag. Each bag contains an electric breast pump and breastfeeding supplies. There's also a receiving blanket in there, a onesie, which is a shirt that goes on the infant to talk about what side the baby should be sleeping, and we always want them to be sleeping on their back. A handmade hat is in there and some other comfort items. When we have events like this, the proceeds help us purchase these items so we can provide them to the families that are in need. Now, if you'd like to make a donation to help purchase some of these items, you'll see envelopes at each of the tables, and you're welcome to put any kind of donation that you want in there. We do have some very special guests in the audience today. We want to thank Manatee County Commissioner Robin D. Sabatino for here. She's here if you want to. Everyone knows Robin D. Sabatino. Dr. Jennifer Bency, who's the administrator of the Florida Department of Health in Manatee. Cynthia Saunders is here representing Dr. Diana Green, school superintendent. And Brody Enright, he's representing State Senator Bill Galvano's office. And we greatly appreciate the support of those folks that are with us today. We also have some of our Healthy Start moms in the audience. And for those Healthy Start moms or dads, if you're here as well, you want to raise your hand so we can see who you are. And I think most of them are, some here in the middle and some off to the left and farther to the left, my left. Thank you so much for being here. This is why we do what we do. And we're so glad to have you with us today. Now we're going to hear from one of our moms today that's going to tell us a personal story.
Hello everyone, I'm Shamika. This is my son Alfonso. And I was interested in breastfeeding because it is the healthiest form of nutrition for the babies. And I was having such a difficult time. And I reached out to my Healthy Start coordinator, and she said, "Oh, let me call Ellen." And I was like, "Okay, good." I was crying. And so she called me and she came out to my house, and I was like, "I just want to warn you that he's going to yell and scream and fight." And she was like, "Oh, no, I can do it." So she tried to get him to nurse, and he had a fit. And she was like, "Oh, my God, this has never happened before." So 2 months later, on the day he turned 2 months old, he latched on. And I was so excited that the first thing I did was picked up the phone and called Ellen. And I was like, "He finally did it. He finally did it." So it just gave me such an amazing feeling to be able to give him everything he needed and bond with him at the same time. It's just a feeling you can't express, you can't explain it, but it's wonderful. So I've been talking to other women that I've come across and telling them about the Healthy Start program and Miss Ellen, and just really encouraging them to breastfeed because, you know, most people find it intimidating. But if they have the right support system, like what they provide with Healthy Start, I think everyone would benefit from it, especially the babies. So he's 16 months old now, and unfortunately, I think it's time for him to give up nursing. But he hasn't been sick. He hasn't had ear infections. So, you know, you see all of this stuff and you read pamphlets, but if you don't apply yourself and try to give your child the experience of nursing. You just never know. But I encourage it. If I had another child, I would do it again. And hopefully I'll be able to call you Miss Ellen. If they're anything like this one. So I just thank you all for having Healthy Start and being such a great support system and making me feel like I can do this and come through and just be happy and have such a wonderful kid. So I thank you.
Thank you so much, Samika, for sharing your story. And we're going to hear more about that when we get to the panel. I already introduced some of the leaders in our community earlier, and I see that one of our school board members, David Miner, has arrived at the event also. We want to thank him for joining us. And now I'm going to turn things over to Bonnie Silvestri. She's going to be moderating our panel today. So take it away, Bonnie.
Hi, everyone, and welcome. My name is Bonnie Silvestri. I'm the Director of Strategic Communications for the Office of Community Engagement and Partnerships at USF. And among the roles that we have is to help research get public, to get research out into the public domain so that we can make the best informed decisions when we have the great wisdom at USF and from all of our community partners. So our role is to bridge that gap between USF and community partners. And all of you are wonderful community partners as well. So we think it's really important and we value those relationships, and it should be a collaborative process with researchers and people out in the community working together to ensure the best information possible. And so I was very delighted to be asked to moderate this panel because breastfeeding is a very important topic to me. We also have a researcher who's going to introduce herself, but she was among our Research That Matters grant recipients. And so we give grant funding to help research happen between our researchers at USF and community partners, and they work collaboratively, as I mentioned. So I'm very excited about this. I also teach a class called Women in the Law, which will be coming up again in the spring, and this is a very important topic. So we will be delving into all the various issues that are associated with breastfeeding. Thank you so much. I'm going to come over here. So I've asked each of our panelists to introduce themselves, to tell a little bit about themselves, and then we'll get into the very important topic.
Is this working? Yes, it is. My name is Ryan Stanley. I am wife to Damon and mother to my daughter Jude, who is 5, and Arbor, who is over there, and he is almost 8 months. I co-host a radio show called Maternally Yours. It's broadcast every Tuesday evening from 6 to 7 p.m. on WSLR, which is 96.5 in Sarasota, Sarasota's community radio station. We are also now broadcast on WBPV, which is West Bradenton's People's Voice, 100.1 west of about 26th Street. We're a low-power station, so you're going to hear us west of 26th and on Anna Maria Island and up through North Longboat Key. Our show focuses on pregnancy, childbirth, and early motherhood. And so my heart and soul is really in the mothers and babies of our community, educating them. And I'm also a breastfeeding mom myself. I breastfed my daughter until she was about 3, and Arbor's 8 months and still going. So thank you all for being here, and I really appreciate being asked to sit on this panel.
My name's Elizabeth Miller, and I'm an assistant professor at USF in anthropology. In fact, my research has pretty much always been on breastfeeding. The reason I was invited was because I had gotten a grant from the Office of Community Engagement and Partnerships to study disparities in breastfeeding. And we were specifically focusing on Tampa General, so my work is based out of Hillsborough County, not Manatee, and focusing on how things may or may not have changed on the implementation of the 10 successful steps for breastfeeding and the baby-friendly designation that Tampa General now has. And our job essentially was going to be interviewing moms rather than providers to see their point of view. My other research projects include recent work on infant and mother microbiomes. So one project I'm hoping to get off the ground is to look at the healthy microbiome in human milk to see how it is impacted by babies back and forth between mom and baby. I'm also on a project with the College of Nursing to study preterm microbiomes. To see if the microbiome has any role in future growth and development of preterm infants, including neurological development. And then my previous work has actually, since I'm an anthropologist, I did my previous work in Kenya on immunoproteins in breast milk. So I have a lot of active research going on. I'm doing comparative studies here in the US right now, hopefully to compare differences between Kenya and the US. And yeah, I've got a lot of research to talk about if you want to hear about it.
My name's Ellen Drews, and I am wife to Matt, who's here today to support me. I also have 3 children. I have 2 sons that are 14 and 12, August and Eli, and I have a daughter who's 10 named Sophia. I am a certified lactation counselor, and I've been with Healthy Start now for about 6 years. And Healthy Start, as Fred mentioned, our goal is to improve birth outcomes. We want healthier women, healthier babies, healthier families. And so all of us that are here today that work for Healthy Start, that's what we strive for. I personally believe that one of the best ways to achieve that goal is right from the start with birth is breastfeeding. And so I get to educate women on the benefits of breastfeeding and the how-tos, basically, so they feel empowered by knowledge and education to be able to breastfeed their infants. And then I'm the lady with the scale that knocks on their door to weigh the baby and check the latch and just sit with mom and encourage her and inspire her that she is on the right track and that what she's doing is the healthiest thing for her and her baby. So I have an amazing job. I love what I do, and I get to feel good about my work every day. And I'm going to pass this on now to Dr. Holly Shen. She is one of the providers that Healthy Start she partners with, and it's offices like hers, her OB practice that really promotes breastfeeding, encourages and supports the work that we do to serve the women to keep our women and babies as healthy as we can in Manatee County.
Well, that was a wonderful introduction for me, but my name is Holly Shen, and I am one of the obstetricians at Premier OBGYN. We've been working with Healthy Start for a few years before I joined them. I've been there with them for about 3 years now, and been lucky enough to work with Ellen not only on a professional level in the office, but also to be a Healthy Start client myself and get the services specifically from Ellen, since she serves our office, and she was able to make my second pregnancy breastfeeding experience a world different than my first, which I'll share a little bit more with you guys about later. But we're really blessed and honored to have somebody that we can designate in our office for our patients to be able to turn to when they have questions or concerns about breastfeeding. Also, education along the way is so important to prepare them for what they're about to face, which for many is an obstacle and something that some see they can't overcome. Most can, but without the support that we get from people like Ellen and from Healthy Start, it's something that would be impossible for us to do in our office. So hopefully we can share some information with you today from not only the scientific standpoint, but from the community side and what we can all do together to kind of continue to foster the awareness for breastfeeding and the support for the patients that we have. So.
Thank you, everyone, so much. And we have new people arriving, and I love seeing tiny faces coming into the room. So I think this is going to be such a great panel. As you can see, we have a lot of wisdom up here on the stage, and also the wisdom is within all of us as well about why breastfeeding is so important. But I do think that, obviously you're here today, so you know that breastfeeding is really valued. But I wanted to delve in more deeply as to why it is so crucial and why society at large really needs to do a better job of supporting breastfeeding mothers. So I'm going to start with Dr. Holly Shen and have her talk about why breastfeeding? Why is it so important from a medical point of view?
So We're lucky enough to be some of the first people that get the opportunity to address breastfeeding as a goal for women, not only when they're pregnant and when they're being seen for their prenatal care, but long before. So hopefully when they're being seen for their annual exams, or we're discussing birth control, or whatever the case may be for their visit, we're able to kind of address their reproductive plan and then bring up breastfeeding as a goal for those people when they do conceive, and let them know that we do have the resources to support them when they're there. But from the physician's standpoint, I think the most obvious is nourishment for the baby. And we impress upon the mothers that we're very, not imperfect in most ways, but very specific and elevated species that requires a very specific type of nourishment for our young, for them to be able to develop into the kind of potential that we have as a species. And no produced form of nutrition can come even close to containing the hundreds and probably thousands of things that we haven't identified yet of features that breast milk contains and formula doesn't. So that's something that we try to share with them. It's also so much more digestible. Our babies end up with so many less food allergies and illnesses as a result of breastfeeding, and that the milk can change over time. So whatever it is that your baby needs as a building block at that stage of development is something that your breast milk is automatically transitioning to. So that's our first reason. I appreciate the applause. The second is the immune development support and the infant health benefits that you get from breastfeeding. A lot of women don't know that the reason why breast milk is, or any milk, is white is because about 80% of those cells are macrophages, which are immune cells that come from the female's body. Those cells in a normal immune system are meant to overcome infections with bacteria, viruses, and fungi that we come in contact with constantly. So that, as being the main component of breast milk, is very protective for the infant. You're not receiving that kind of nourishment or protection when you're using a formula or a substitute feed. So that's something that we always counsel them about. We, as a practice and hopefully as a profession, are very in tune in educating our patients about the importance of vaccinations that are required or recommended during pregnancy, including things like influenza or the pertussis vaccine that's been in the news a lot lately. That is something that is passively passed through the placenta as the mother produces those antibodies to the baby. And even if someone's against vaccinations for their baby is receiving the vaccinations that the mother has responded to. So that's very important in protecting babies before they're safe for receiving those specific vaccines at certain times in their development. As babies get older, they're also a lot less likely to have things like asthma, food allergies, like I mentioned, and even protection from childhood and adulthood obesity and cardiovascular disease. So we're finding things every day health-wise now that we're concentrating on the difference between breastfed babies and formula-fed babies. Our babies are smarter when they breastfeed, which is fantastic, and they have a lot less risk of having childhood cancers to develop. So those are really big deals. For mom benefits, and sometimes these are things that they listen to a lot more than they listen to for baby benefits, which kind of baffles me sometimes. Your uterus is going to return to normal size a lot more quickly with breastfeeding because it does cause contractions each time that you feed. And mom's going to lose her pregnancy weight a lot faster than she would have normally, which is, who wouldn't want to burn an extra 600 calories a day with doing, not too much physically. So that's always something that we use to encourage. And also, mom herself will have much less likely risk of having breast cancer later in life, as well as ovarian cancer, from that reproductive rest that she gets from likely having the lack of ovulation during that time. Bonding is a big deal as well. There have been some studies that have come out from infants who are in NICUs and don't have the either the capability or the opportunity to breastfeed, and they're lacking that bonding and that touch of having their mother with them and holding them regularly. Those babies are a lot more likely to die. The mortality rate is much higher for babies who aren't breastfed or aren't routinely held. So that bonding is very important as well for ensuring better outcomes for early babies. And Miss Ellen will go a little bit more into the effects of bonding otherwise. And the last thing is what I call the duh factor, because it just doesn't make any sense not to pay attention to the benefits that breastfeeding is way cheaper. So formula is really expensive, and anybody who's formula fed knows that it's never the first formula that you use that your baby works out well with. It's skip to this one, change to that one. Now they're lactose intolerant. Now they need, soy, and then they need the alimentum because they have reflux and all these things that come about. And by the time you've gone through 10 different formula types and you settle in on one that's $200 a month, who's going to pay for it? So that's a big deal for our moms as well, is it's really cost effective. Plus it's perfectly packaged and ready to go, and there's no trash, so it's safe for the environment as well. So those are the things that just doesn't make much sense to acknowledge that those are huge benefits for moms all around.
Well, I think that this is really great because I know as a pregnant mom, I was sold. Like, I absolutely wanted to breastfeed. This made it a priority. But then we can get into a little bit about some of the difficulties. It's not necessarily as easy as one might think it will be. So that's why it's so important to have access to a lactation consultant. So I would ask Ellen to talk a bit about what are some of the stumbling blocks that can happen where a mom knows that they want to breastfeed, but it can be difficult to get that process started, and then also a bit about bonding as well.
Sure. I believe strongly that it still starts with education. We can want to breastfeed, which is a great place to be, and that's a starting point. But just something simple as how a woman's body produces milk, how a newborn's baby responds to feeding in the first week or two of life. If you don't have this basic information, it makes it very difficult to be successful at breastfeeding. You're already, facing a lot of roadblocks just going into it. So if I could make anyone aware of anything today, one thing would be to encourage people to seek education about breastfeeding if they're planning to do so that they can just have that knowledge to be successful. But common pitfalls that we see happen are perceived low milk supply. That's actually perceived far more than it is actual. Low milk supply is when a woman believes she doesn't have enough milk to feed her baby. Generally, the rule is if you can grow a baby, you can feed a baby. But when we intervene with this process by trying to take control of it, maybe overpumping or supplementing with formula, doing anything that shuts off connections with our body, we interrupt the supply and demand process. And so sometimes we just need to help a mom realize that, get back on track. That's really one of the most common issues in the beginning. Sometimes for whatever reason, baby isn't latching well. Maybe it's baby's mouth. There is tons of reasons I could go on and on about why a baby doesn't latch well. But if it is the case, then that baby sometimes isn't gaining as quickly as we'd like to see them gain. Maybe they're having difficulty staying hydrated, having enough wet diapers. Those are reasons for women to throw in the towel. And that's when it's great to have a lactation counselor patiently sit with mom and observe that baby feed, help make corrections, help that mom learn to observe cues in that baby, hunger cues, when the baby's full, how to know if they are truly getting enough, so we can rule out any perceived low milk supply problems and just help that baby be a confident nurser and mom be a confident breastfeeder. And then, of course, as babies move through different phases, moms may be returning to work, babies sleeping through the night, the introduction of solid foods. These are sometimes reasons to reach out and need more support because it's a new phase of breastfeeding, and we don't want to leave women. We don't want to get everybody fired up and excited about breastfeeding and then be like, good luck, hope it goes well. We need to be there and be available to these women to support them through that process.
Thank you so much. And I think we also want to hear about Elizabeth's research. I saw a lot of people getting very excited to hear more about what she's working on. I've been interviewing her in particular about the disparities, why there's such a low discharge rate of women breastfeeding out of the program she's been working with, and also about some of the benefits that she's determined through her research as well.
Great. Well, I will say that that this research is still in progress. So we're still interviewing moms. We haven't analyzed the data. So I really can't give you any firm conclusions, but I can talk a little bit about how the research got started, in a sense. So I partner with Hillsborough Breastfeeding Task Force, which is a group of professionals operating out of Hillsborough County who are invested in raising breastfeeding rates in Hillsborough County. And as part of that, I met some friends and colleagues who work at Tampa General Hospital and learned about the steps they were taking to move Tampa General toward having a baby-friendly designation, which I think there are a few hospitals in Florida. Is there one in Bradenton that's baby-friendly? I don't think so. Yeah.
That's a goal. That's a goal. For sure.
Well, it's not actually necessarily a goal for a lot of hospitals, but for Tampa General it was. They implemented many of the steps, and that included altering a lot of their education. And we pulled some of the numbers, and we actually found that we did see some shifts. So there was a large shift in percentages of moms who were initiating breastfeeding and who were exclusively breastfeeding at discharge. When we broke it down by ethnicity and we broke it down by clinic, we started to notice some disparities. So women at Genesis Clinic, which tends to serve somewhat higher risk and also lower income mommies, did I just say mommies? They tended to have lower initiation and lower discharge rates. And we broke it down by ethnicity. African American moms had the lowest rates of them all, which is something that's reflected at all income levels at the national level too. So Tampa General is not the only place that has this. So we wanted to start a project to address these inequalities, and my collaborators are providers, and so immediately they thought, well, we can do this, and we can do that, and we can do this. I'm an anthropologist, and I'm interested in investigating a little bit more the people who have less of a voice, I would say. So in our case, I said, why don't we stop and why don't we interview patients instead and get their point of view and get their frame of reference. So we can see your side, the provider side, but we can also see their side and see what might be appropriate for these moms, supporting these moms that would fit in sort of their worldview, because an intervention will not work unless it aligns with somebody's worldview. So that's really where that research is coming from. So we're interviewing moms right now, and we will be analyzing the results pretty shortly. So that's that research. I don't know if you want me to elaborate on more. I could talk for a while.
Well, maybe just tell us a little bit more about
The microbiome research, yes. Okay, so I am part of a team led by Maureen Grohr at the College of Nursing at USF, who we just received a $2.7 million grant from the NIH to study the preterm gut microbiome. So we had initially enrolled moms into this study, moms who had been, or moms and babies, and the babies had been fed pumped milk in the NICU, and they also collected stool samples, which we're now going to analyze, and we're going to see what the effects of the milk immunobiology is on the microbiome. We're going to see what the environment of the NICU effect is on the microbiome. We're going to see how the microbiome impacts growth, and then we're going to be following these babies at 2 and 4 years. So we're also going to have a long-term follow-up. Unfortunately, preterm infants have a higher rate of neurological issues and other developmental issues. So, and this area also has been understudied in microbiome research. So we're really one of the first projects to get a handle on that. So that's a big deal. And then along with Maureen, she and I we're still trying to look for funding. We're still trying to convince the funding agencies to get some money to look at the milk microbiome. So the healthy bacteria that are in milk. We're going to be looking at that in U.S. moms and Kenya moms to see if there's an environmental component to that, to see environmental differences between the two. And we also, this is a little side note, but it's very cool, we're going to sequence the microbiome of baby spit too, because it turns out that a little bit of spit actually backwashes into the breast, and the microbes from the baby communicates with mom to say, hey, I might need something here. So we're going to try to get money. I can't believe the NIH doesn't like it. I don't understand. I think it's so cool. So we're working on that as well.
That's really cool. I think I'm so excited that you're working on that project. Yes. So now we're going to turn to Ryan. So I think Ryan and I share a real strong interest in how we can ensure that society and employers mostly really understand the importance of breastfeeding. Once moms go back to work, there are a lot of difficulties with maintaining breastfeeding because employers don't always understand, as we know. And then there are as well, people out in the community who don't seem to understand. And maybe at a restaurant, a mother's told to cover up, or things that come up on a relatively regular basis. I know Ryan has talked about this with me before. So I think we really, as a society, need to realize how important breastfeeding is and look at how we can support it. So we can talk about, there are breastfeeding laws, but are they being followed and complied with in the way that they should be?
Was that a question? I think we're all aware, or I hope that everyone in the room is aware that there are laws on the books that protect breastfeeding mothers in the workplace, and those laws basically say that employers of a certain size business are required to provide their breastfeeding employees with a clean, private space to express breast milk that is not in a bathroom, and that you need to provide time for those women to pump breast milk, and these are fairly easily accessible laws. We have this wonderful thing called Google, where you can find all of these things, and unfortunately, we're finding that a lot of employers are not knowledgeable about these laws, and a lot of women are not knowledgeable about them either. And so they go back to work and they ask for a space to pump, or maybe they are just afraid of losing their job, and so they don't even ask for the time or the space to pump. And that's why we're seeing, this is a huge barrier for women. And so we are seeing these dramatic drop-offs in breastfeeding rates. In Sarasota County, we have the Healthy Start Coalition in Sarasota County has worked with some local advocates to start a program where businesses can sign up to be breastfeeding friendly. And so you acknowledge as a business that you understand the laws and that you will provide your employees with the time and space to pump breast milk. And there is a similar thing. There is similar workplace wellness initiatives happening in Manatee County. So hopefully we will see this tide turn. But as recently as over the summer, we got a report on our radio show from a local breastfeeding advocate who said that 2 employees at the new mall at University Town Center were being told to use the bathroom to pump breast milk. And this is a regular occurrence, unfortunately. So it's really up to the employers. Do you want employees who are emotionally available, I guess, and physically available to provide their time to your business, and allowing them the time and the space, and really making it an open environment for talking about these things when people are coming back to work from their maternity leaves. If you are providing them with that time and space, you're going to have employees that are willing to work very, very hard for you. So there's that, there are all these incentives for employers. We just need to maybe get a handle on that education piece, I think.
Yes, I think we should delve into this a little bit more deeply, too, because there's sort of this intersectionality issue where people want to have great civil rights, but yet there's sort of a weird discomfort around breastfeeding. And I mean, even the fact that in the law, it's sort of a woman will be exempt from being considered lewd behavior. It's sort of hard to read that because I don't even see how that's an issue. But so many people do, and I know particularly of like my mother's generation feel that way. So I thought maybe we could delve in a little bit more deeply into that, because I think that once we have a greater sense of respect for this process, we might see some improvements. So what do you think about that, Ryan?
Well, for those who don't know, the law in the state of Florida in terms of public breastfeeding, the state of Florida has taken a very clear stand on this, where they understand the importance of breastfeeding, and so any woman is allowed to nurse her baby in any way that she sees fit, in any place that she is allowed to be. And whether private, public, wherever a mom is allowed to be, she is allowed to nurse her baby. And like Bonnie said, it's actually included in the statute. The mom will not be prosecuted for being lewd or any kind of indecent exposure, because in the process of nursing, you are going to see more breast than you might otherwise. What we've seen a lot of as journalists on Maternally Yours is that we will have people in the community who will say, I support breastfeeding, but could you cover up a little bit? Could you be a little more discreet? Could you use a cover or go somewhere else to do that? And I think as a culture, we need to really get over this uncomfortableness that we have with feeding our babies the way that we were made to feed them. Our breasts are here for a reason. We can use them to sell any number of products, but when you put a baby on it, it kind of makes people a little uncomfortable. So the unfortunate part to this is that there is no teeth. There is no there's no enforcement of these laws. There's no teeth behind them. So if a woman is sitting in a restaurant and the restaurant owner comes over and says, "Excuse me, ma'am, you need to put a napkin over your baby's head," and that woman knows her rights and says, "Actually, no, I don't. The state of Florida says I can nurse in any way that I want. Whether my nipple is exposed or you see any extra part of my breast, I have the legal right to do so." There's no enforcement. So that business owner can essentially get away with whatever they want to. They can kick the woman out if they want, and there's no civil action that can be taken to enforce that. So we have to ask ourselves as a society, what's more important here? The health and well-being of our babies, or this sort of like prudish nature that maybe we have as a society, that we're very uncomfortable with this idea of nurturing our babies from the breast.
Yeah, we're really getting to an interesting point in our history, and I teach a civil rights course, and where my rights end and your rights begin, and how that clash is being handled. And I do think we're moving to a better time where things are more accepted. But until we get there, there are going to be these moms that Ryan's been telling me about, who are sort of essentially kicked out of a place or made to feel uncomfortable. Ellen, I thought we could turn to you. And what are some of the impacts if there is this sort of nervousness about breastfeeding? Doesn't that then impact the ability to breastfeed also?
Definitely. I think it's really important I think if people understood what goes on in a baby's world while they're nursing, we wouldn't be so apprehensive of a mother breastfeeding in public. So I just want to share with you a little bit about kind of what happens to an infant when they're put to the breast. So when you put a young infant to the breast, one of the first things that happens is their body temperature starts to get regulated. They have a hard time, especially young infants, maintaining a stable body temperature. So breastfeeding right there, warms their body. As soon as they begin to nurse, if they're feeling any physical pain or emotional stress, they receive some hormones from mom that begin to calm them. So if they're stressed, if they're at a restaurant and it's overwhelming to them, the minute they start nursing, their neurological response will be to calm them through the act of breastfeeding. If they are feeling pain or discomfort right after they have a procedure, a circumcision or shots, they should be encouraged, put that baby right to the breast, because they will literally have pain relief by breastfeeding. So when we know these things are happening to the baby, it seems ridiculous to deny that to a child because it might offend somebody. Also, what's happening is each time that mom and baby have this exchange of breastfeeding, mom is also triggered with a hormonal response that increases her attachment her bonding and her trust between she and the baby. This is so important. If we look at an overall impact on this, there's a study that can be found by the Academy of Pediatric Association, and it explains that there was a 15-year cohort study done on 7,000 Australian mothers and infant pairs. They were followed for 15 years, from birth to age 15. And what they found that was interesting, the conclusion of this study basically was that at the end of 15 years, the group of children that never suffered any physical abuse, neglect, or maltreatment had a common link. They had all been breastfed for more than 4 months. So, breastfeeding causes a bond and attachment to a baby that could have lifelong protection for this child, because this mom is motivated to always seek protection for this baby, advocate for this baby, be attached to this baby. Children need this, not just when they're tiny, when they're 6 years old, when they're 14 years old. We need mothers invested in their babies. And so I think when we're, as a society, if we're uncomfortable with a woman feeding their baby, we have to consider, do we know this? Do we know what's really happening to this mother and infant and what this means for us as a race? We are human. Relationships are what drives us. Our survival is dependent on relationships, our happiness. And so we don't, want to try to advance ourselves out of breastfeeding. That shouldn't be a goal, because after all, breastfeeding is as much about relationships as it is about nutrition or anything else. And so I hope I answered the question.
I love that answer.
Okay.
That was spot on. I thought maybe, Holly, we could have you talk a little bit about your personal experience, why you felt a big difference when you did have the help of Ellen. It was Ellen, right?
So my first pregnancy was not in Florida. It was in Georgia. So location difference. But I had an ironic start to that pregnancy. I was between medical school and residency when I conceived, and then delivered about 6 weeks into my intern year, which could have been the most horrid timing on earth. I am aware of, but nature does that sometimes. And as an educated person, and even medically educated, not educated obstetrically at that point, or to anything to do with to the degree of breastfeeding, what I didn't know, of course, is what everybody else thinks is, yeah, of course I'll breastfeed. I'll take the baby, I'll put it on the breast, and it'll suck, and it'll be fed. And that's what breastfeeding is. And that's kind of the idea that the public has without the support and the education that we're trying to encourage. And I fit right in there. So as my intern year, into my intern year, of course, I did not receive the support I did from my provider, but not the education, just the support. But without the aligning the education and having me see a lactation consultant during the pregnancy, right before delivery, right at the time of delivery, my only interaction was with the lactation consultant after a very, it was an easy delivery for me, but a tough delivery for my child. So I was thrust into a situation of a baby who didn't breathe well at delivery and was on CPAP for 45 minutes after, and when it came time to getting the baby to the breast, she wasn't having it. She had been through a lot of stress. So having that lactation consultant there for a few minutes at a time, but without having any background education as to what to expect when she walked out the door, really, was really tough. And the ironic part of it was I was an obstetrician at that point, which sounds ridiculous. I should have been educated. I should have had some of that education to share with my patients. We don't receive any of that. Even throughout the 4 years of residency, you get cumulative of maybe 5 to 10 hours of lactation education. So there's very little that your residents are receiving and coming out as providers. So it's hard to know what to support other than to say, yes, you should breastfeed because it's good for your baby. So I got caught in that loop. But then also, I went into a back-to-work mommy position of no support from my workplace, which again sounds totally ridiculous since I was working for an obstetric program. So it doesn't make too much sense. Although I'm sure the laws applied back then, I was terrified to say anything about being provided time and space and support for pumping or any further lactation education and care. I was unhappy at the fact that they didn't support me around time of having a baby. So it's even felt in areas where you would think that those people have the most knowledge, that they should be supporting their reproductively aged moms and making sure they have the support and education they need. So I made it about 3 weeks. And that was a sad thing for me. It was gut-wrenching to decide that I had to quit. I didn't have the support I needed. I didn't know who to turn to. And I knew when I went back to work that I'd be facing a huge hurdle. So that situation turned directly to formula feeding. The second pregnancy, I was lucky enough to already be in Florida and to have Healthy Start. And the first thing I was told about Healthy Start was just say yes to the services. Just sign up and just, even if you don't do anything else with him, the only thing you really need is at least the lactation education. So I knew I needed that. And I told Ellen in the very beginning, I was like, you have a job. You have a job ahead of you. So she committed, luckily. And that pregnancy, I was able to receive education along the way, and I was able to at least, and probably on a brighter note, be more supportive for my patients along the way while I was pregnant too, because I was learning for myself, but learning for them as well. And so when it came time for my education visit, I was as open and uninformed as anybody you would get that would walk off the street. So the information that I got from Healthy Start and from Ellen let me have the support and education before, also let me educate my partner, which is exceedingly important to have support from your partner. They're the ones who are there to encourage you at 2 a.m. And to have a successful initiation of breastfeeding in the hospital, and then support when I left the hospital as well. I had somebody I could text. I had somebody I could call. I was the one bleeding and, couldn't get the baby to latch and was wondering about my supply. And every single thing that, I'm sure Ellen was over there just checking the boxes on her worrywart list as she was hearing from me. But with the support, I was able to continue not only breastfeeding until about 13 months is how far we went, but to go back into my workplace confident that I could ask for where I could pump and when I could pump and take away from my patients and say, I'm sorry, I love you, but I love my baby more, so I'm going to go pump right now, and I'll be back in 10 minutes. I appreciate your understanding, and have that support all the way through, and then be able to share those experiences with my patients as well. So just because you had a not so great first experience, because you didn't have the tools you needed, when you do have the tools you need, it's a world of difference. So.
I really love what you said, just because I think, so I'm a lawyer licensed in New York, but people are always like, well, you know the law on that. But I mean, really, I don't have an entire shepherd's, list in my head. So I don't always know exactly what the laws are myself. But what I do know is that you have to stand up for what you believe and do your research. And so I really love what you're saying, that, even in the medical community, you really weren't receiving the support that you should. So I think it's important to know this isn't only taking place. I mean, what I really feel for are women who are in the service industry who are going to have a really hard time breastfeeding. But Holly was talking about even in the medical community. What could we do to support women in the service industry? I'm thinking about that, and we're almost out of time, but maybe just a quick last question about that. And then, were there questions that people wrote down, or we don't have them? Oh, so we can keep going. Okay. So what should we do about that? Because I think there are so many women that really need assistance, particularly a topic that's of great importance to me is the fact that there's no paid maternity leave. So people may have to get right back to work within 2 weeks. So what can they do about that? Whoever wants to take that one.
In addition to my work on the radio show, I'm also a postpartum doula. So I see women soon after they've given birth. A doula is someone who supports a woman during their childbearing year with practical, emotional, educational, physical support. So what I see a lot of is women who have not gotten the education from their medical providers, and women are very open to hearing from their providers all of these education pieces. So whether it's childbirth education or breastfeeding education, postpartum planning, all of these things we should be hearing about through our medical providers during our pregnancy. So what I would like to see is at the 30-week appointment, somewhere in your third trimester, you're being asked by your obstetrician or your midwife, what are your plans for your immediate postpartum period as far as breastfeeding are concerned, and then what are your plans for transitioning back to work if that's what you're going to do? Because then that gives the provider a little bit of an opening to say, well, here are some services that we can connect you to help that to help that be an easier transition for you. When Ellen is providing her education, letting women know that they should be asking these questions of their employers. Please do not be afraid, or at least helping them navigate that. Because one thing that I said to Bonnie before we started was, I think that with the economy the way it's been over the last 5-10 years, people are afraid of losing their jobs. And so that's a very tough ask to make of your employer. I hear it from teachers all the time. I hear, and not just not just people in the service industry, but our teachers, our nurses, our other types of professionals. They are afraid to ask for these accommodations because they are afraid to lose their jobs. And so encouraging women to have those conversations during their pregnancy, so you're not at 2 weeks, 6 weeks, 8 weeks, 12 weeks, coming back to work into a situation that is not sustainable for your breastfeeding relationship, because that is the number one relationship at that point. It really has to be.
I think this might be a great point to turn back to Elizabeth, because as you're interviewing mothers, that you're interviewing them before they return back to work. So do they talk to you? Because she is such a great interviewer. I ended up telling her my whole breastfeeding story also because she's so good at it. But anyway, she is talking to mothers. So do they express fears and concerns about going back to work and how they'll manage?
They absolutely do. That's a primary concern because a lot of these moms are working mothers. Some of them express concern about where they're going to pump, how often they're going to pump. Some said, I'm just not going to pump at work. I'll pump at night and feed my baby at night. Many women are unaware of that technically under the law, depending on how many employees there are, they are allowed to have that time. They don't have any idea. Finding pumps, electric pumps for moms can be difficult in some cases. They're not always easy to find, especially if you're on Medicaid. And having just a manual pump in a workplace setting is not really going to cut it. You need that electric power to pump effectively. So there's a wide variety of issues that these moms are concerned with. And again, we're not done with the interviews, but those are some of the things that I heard brought up.
I just want to add one thing to that. Breastfeeding doesn't have to always look the same. So for each woman and for each baby, it is unique. So when I meet with our moms with Healthy Start, one of the first questions I ask them during their pregnancy, hopefully around the 28-week mark, is when do you plan to go back to work? What are your plans when you go back to work for childcare? Do you feel your employer will support breastfeeding, and what kind of work do you do? And they kind of look at me like, what's next? What toothpaste do I use? I mean, these are a lot of questions from a breastfeeding lady. But it's important because I need to know how I can support her 4 weeks after the baby's born, 6 weeks after the baby's born. And it's important that mom understand that she doesn't have to breastfeed the same way her neighbor did or an aunt did, that we can tailor a plan together that works for her to support her lifestyle if she has to go back to work early. I hate to point out a Healthy Start mom, but I have one mom here who was really creative and had to go back to a really busy job working in the medical field, and she was able to arrange with her husband to bring the baby at lunchtime for one of her feeds so that she could maintain work and maintain this breastfeeding relationship. Shamika as well did that. I know on her long shifts, Dad was bringing baby. I'm talking about you. That's really important that we can come up with creative solutions. And sometimes moms think, well, if I can't exclusively breastfeed, I just won't do this. And we want mommies to know you can have your own style, your own plan. We can help you with that because breastfeeding looks different for each family.
I think that is so important because there is a lot of guilt associated with it, as I can attest to. If it's not, I like everything to be perfect, and if it doesn't work out perfectly, I get frustrated by that. I know we have one question from the audience, and I think he's going to come here just so that he can be on, because we're being filmed by METV. And this will probably have to be the only question because we're almost out of time.
That's a lot of pressure. So I'm Phil Brown, the president of the local United Way Manatee County. It's a question and a comment. As I'm listening, I want to connect I had a question about what a baby-friendly hospital is, and I think the answer is that it's one that promotes by their behavior. New Moms promotes breastfeeding as the way that children ought to be fed. So they don't provide product and those kinds of things, right? Have I sort of got that in a layman's perspective?
Yes, essentially, yes. There's several steps that support breastfeeding.
So
yes.
let me connect the issue of why we have other reasons to promote breastfeeding. And that is, we know that the campaign for grade level reading is about third grade, being able to read on third grade by the end of third grade. And amongst the many reasons why we're challenged to have that happen in our community is that children are not arriving at school ready to learn, and going all the way back to prenatally, children, babies, need a healthy start in life. Now we're at breastfeeding. So there is an advantage to our community to have our employers, all of them, and to have our hospitals be invested in ensuring that our children are getting a healthy start in life so they have a chance of succeeding when they arrive at school, because that's going to help our community down the road to have a viable workforce that's going to make this be a wonderful community that it is and continue to be that way. So that's more of a comment, but I think there's strong incentives to ensure that we have baby-friendly hospitals and employers that are promoting, doing everything they can to ensure that children are raised and moms are able to breastfeed. Thank you.
He actually wasn't planted, but that was my last question about what should we do as a community. So I think that was actually really fantastic that you brought that up. Is there anyone that would like to comment on that in our last few moments? Oh, yes. I think, okay.
Thank you so much. Just briefly. Hi, Jennifer Bensi, County Health Officer here in Manatee. We had the Chamber Coffee Club this morning, actually, at the Health Department, and the focus was on worksite wellness. We're doing an initiative with the Chamber and Blake Hospital to make sure that all of our businesses in Manatee County are focusing on wellness. And we spoke about breastfeeding and the importance of it. We have those resources and rooms available for our staff and clients, especially through our WIC program, Women, Infants, and Children. And so we're using that as an example this morning for those who were there at the Health Department through the Chamber to talk about this initiative that we're going to be kicking off formally after the new year, which will involve certification for businesses as they become healthier. And this obviously will be a big component. So thank you so much for your support and what you're doing in Manatee County currently. You are making a difference. And we also just put a WIC program at Manatee Memorial Hospital so that we're capturing the women and the babies right there before they leave, making it as convenient as possible to get the resources that they need. So thank you again.
Thank you. I think we are out of time, but I really think we covered many of the important topics, and I believe the panelists will be available if you have specific questions for them afterward. Thank you.
All righty. panel. Thank you, Dr. Bensey and Phil, for those comments. What they said is kind of really gets at the whole mission of Healthy Start. I think one of the most important things we can take away from this, and then we're going to go back to our panel and wrap up what they just talked to us about, is that Healthy Start is not an income-based program. It's not eligibility based on low income or whether or not someone's qualified for Medicaid or not. Healthy Start is really for everybody. It's for all families in Florida. And it was the wisdom of the founding fathers, our community leaders, our legislature, and our governor's office to keep it going and alive, because it's important that all children, all families have what Healthy Start can offer, because a healthy start in life is the best thing we can give to our children, and all the steps that it leads to that Phil so eloquently talked about, and Dr. Bensey talked about, being in the workforce and making sure we have a good workforce so we have good economic growth and return to our strength in the world in terms of being the #1 leader in the world. So Healthy Start is the very beginning of all of that, and it serves the largest number of individuals in the state of Florida than any other program other than public education. We have about 215,000 births every year in the state of Florida, and Healthy Start serves between 60 and 70% of those individuals. So when you look at the pregnant women, and then you look at the infants that are born after that, we're serving between 200,000 and 300,000 families, either during the pregnancy or after the baby's born every single year. So the little bit of money that's put into the state budget is a grand investment for a grand return. And I wanted to go back to our panel and thank Bonnie for facilitating the panel and moderating that. And wow, wasn't that a very different kind of discussion that you've heard before? We all know that breastfeeding is important, but what they talked about is really, it was very spirited and frank. And when David Miner had to leave, he came over to me and he said, I have to go, but I want to tell you this was great. This is what people need to hear. Mm-hmm. And it's not what we normally hear when we talk about the topic of breastfeeding. And I want to thank you all so much for contributing what you did. I can't thank you enough.
Thank you.
All right.